Hello and welcome. My name is Dr.Novick. I am an emeritus clinical professor of dermatology at the Mount Sinai School of Medicine in New York City, and I have a private practice devoted to cosmetic and aesthetic dermatology located in Manhattan's Upper East Side. The subject of this video is lunchtime beauty fixes, in essence, non-surgical techniques for reversing the effects of aging on the skin. But first we need to understand what goes on when we have aging of the skin. A major component of aging of the skin is loss of volume. We lose volume in the muscle, we lose volume in fat, we lose volume in soft tissues, we lose volume in bone. And this means the loss of the infrastructure of the skin. What this translates into is basically we have flattening of the temples, we have loss of cheek projection, we have sagging of the nose and dipping down of the nose, we have loss of projection of the chin, and we have loss of definition and jowl formation along the jawline, and we have sagging and drooping of the neck. In addition, we have a paradoxical effect of hyperactivity of the voluntary muscles of expression in the face. This is in contrast to every other voluntary muscle that in the course of aging loses its mobility and loses its volume. The muscles of facial expression become hyperactive with time, and so they are responsible in their hyperactivity, especially as we lose integrity of the fabric of our skin above, which will be the subject of another video. When these muscles overreact, we get the horizontal worry lines, we get crow's feet on the sides of the eyes, we get the 11 lines between the eyes, and we can get vertical bands on the neck, all from this hyperactivity. But this will be the subject of another video, but we also lose the integrity of the fabric of the skin. Its ability to be elastic and to be taut is lost through sun damage, through aging, and this is a very, very important factor which we will discuss its treatment in another video. There was a time not that long ago that we thought that the only solution for aging of the skin was plastic surgery, surgery to remove the excess skin and pull it taut and sew it together. However, in recent years, there's been the development of natural hyaluronic acid-based fillers devoted, and each one specified for a different purpose, to be able to take care of restoring projection to the temples, elevating the eyebrows, giving back the OG curve to the cheek, restoring projection to the chin, elevating the tip of the nose, straightening the neck, defining the jawline, eliminating jowls, all through a variety of different HA, hyaluronic acid fillers that are designated for those specific purposes. Just imagine pulling of the skin, stretching it, and cutting off the excess, creating a very taut, porcelainized look, like porcelain, or a kabuki dancer's look, is not something that can be acceptable. Think about it this way. Imagine you have a beautiful dining room table and it has 3 leaves in it. And then you go out and you buy a beautiful tablecloth that drapes just so halfway down to the floor, all the way around that beautiful table. And now all your guests are gone. And what happens? You want to take out the leaves of the table. And you take out the leaves, and now you put the tablecloth over it. This tablecloth that once hung beautifully around now sits on the floor all the way around. Would you conceivably go around with a scissor and cut that tablecloth so that it would be hang halfway around your table? It's inconceivable. You would simply put back the leaves. So the use of hyaluronic fillers, hyaluronic acid-based fillers, is essentially restoring the leaves of the face back into place so it looks natural rather than skeletonized. So today, to repeat, we do have lunchtime beauty fixes. People do come and they can have, over a lunch hour, they can have the restoration of chin projection. They can get high cheekbones. We can elevate the eyebrows. And we can take care of the hyperactivity of the muscles with neuromodulators like Botox, so that when people smile, you don't see deep crow's feet, you don't see deep 11 lines, you don't see these horizontal worry lines, and you don't necessarily have to have bands, vertical bands on the neck, with the use of the appropriate neuromodulator injected by an expert injector. In each case, that's a critical issue. An expert injector with experience to be able to inject these agents can transform a face during a lunchtime break. For more information about this subject and other subjects, you can check out our website, youngerlookingwithoutsurgery.com. That's youngerlookingwithoutsurgery.com, or Dr.Novick.com. That's DOCTORNOVICK.com. Thank you.